Hello and welcome everyone to this NICE webinar on commissioning and providing support for people with a learning disability and behaviour that challenges. I'm Jonathan Senker.
And I'm Karen Fuchs.
So welcome and thank you for joining us. I was the guideline committee chair and my day job is as the chief executive of Voiceability. I've also got a sister who has learning disabilities.
And I was one of the committee members, and I'm also a consultant clinical psychologist for Sussex Partnership, working with adults with learning disabilities.
And we're sitting in a rather sunny room in London at the SCIE's offices, and in the offices with us is Steve and Kim, who are helping us with this webinar. So we're going to get cracking straight away and let you know that we're just clicking on the next slide. This is, as I say, the webinar on learning disabilities and behaviour that challenges service design and delivery. So if you've come for information about the application of GDPR, I'm very pleased to let you know that you're in the wrong place. If you've come for to understand better the guidance on how to shape services for people with learning disabilities and their families where that person has challenging behaviour, welcome, and we're very, very pleased that you've joined us. This was perhaps the most popular webinar that SCIE have offered on the guidelines. We had over 300 people applying very, very early on to join us. And I think that reflects the level of interest and concern that there is on this topic. If I tell you a little bit about how this webinar is going to work, as many of you have already seen, there's a chat function where you can make comments. We're going to pick up on some of those comments where we can do as we go along. There's also a poll function which we're going to use to check out your views on things. And Steve, I wonder, just to test that out, perhaps you could do a quick poll for us and check with people whether it's sunny where they are. Okay. So just coming up now.
Great, that was quick.
Fabulous. So as you can see, throughout most of the people that are listening, it's a sunny day today. We can confirm that. It's evidence-based, it's true. We like that. So to give a little bit more background, the guidelines were commissioned by NICE, that's the National Institute for Health and Care Excellence, and we describe on this slide the key objectives that NICE has. Particularly significant is that for the last 5 years, NICE has also been responsible for providing guidance in social care. And this guidance was commissioned and developed in collaboration between NICE and SCIE, the Social Care Institute for Excellence. We're going to cover in this webinar the following things, just clicking on to the next slide. So we're going to talk with you about how the guideline was developed. We're going to particularly pick up on some of the critical issues that we think make the difference in the lives of people with learning disabilities and their families in terms of the service setup. So commissioning, supporting families, services in the community, housing, specific support for children and young people, inpatient service, early support and intervention, which are cross-cutting themes across this. At various stages, we're going to ask you the same questions, and we're going to ask you those questions in a poll. The first question, is this working well now in your area? And the second question will be, could the guidelines help in planning change? As we talk through this, we're also going to draw on some particular examples that bring alive for us some of the recommendations in the guidance. Those case studies aren't necessarily in the guidance itself, but they illustrate the themes well, we believe. the development of the guidelines followed in some ways a very established practice by NICE of using the best available evidence and drawing together people who could really help us understand and interpret that evidence in a way that would make a practical difference in people's lives. So in some ways it followed a well-established practice. In one way it was new, and perhaps new throughout the world, in that we involved people with learning disabilities who are experts by experience as full members of the guideline committee. And we say a little bit more in this slide about how the guidance was developed.
Yeah. I'm just wondering what to do the poll.
Can we just check with people how many people have A, read the guidance, or B, had a chance to have a quick skim read of it, or C, have yet to have a look at it? Or just give us a sense of where you guys are coming from. Yes, please, a poll, Steve. And just as we're pulling that up, I think perhaps if we go on current, talk a little bit about the need here.
Yeah. So the statistics on the slide, they won't be new to a lot of you because they're within a lot of the other guidance that's come out recently. But they're really important. And I guess it's saying that 1.2 million children, young people and adults in England have a learning disability. That 10 to 17% of those people estimated to have behaviour that challenges, and over 40,000 children with learning disabilities who display behaviour that challenges. And I guess what we're saying in this guidance is that we're going beyond the people who are within assessment and treatment units. We're thinking about the widest group of people across the lifespan, and they're often the people who are most in need and most poorly served.
Okay, and the poll is just coming up. We've just sorting out the technicalities on that.
Oh. Bear with us.
Okay, so the poll is up there. And as the results are coming in, I think we can see that quite a number of people have read it, a good number have had a quick look, and probably roughly half people haven't yet had a chance to look at it. So that's really helpful in giving us a snapshot of where people are up to. We will take people through, so that whichever group you're in, hopefully you'll learn and take something helpful from this. Why were we doing this? What was the purpose? The fundamental purpose for us was about improving the lives of people with learning disabilities whose behaviour challenges, and improving the lives of families. It was about providing advice about what works best based on the best evidence. It was about providing a practical resource that could be used to the best effect, and as a tool to identify, to argue for, and to develop the right things. I know personally, as a family member, actually at times having NICE guidelines when going in to meet with clinicians can be a really helpful thing. It's a guidance to inform and encourage responses. It's not a blueprint. It doesn't say in a colour by numbers way, this is how exactly things can be done. It was based on a set of clear aims and principles, and we've listed quite a number of those in this slide here. So those were the basis upon which we set out to develop the guidelines.
Okay. I think just to add to those aims, there was a strong message within the guidance committee that most people who do most of the care and support, such as families, often get the least resources, and we really wanted to kind of keep that in mind as we were talking. So in terms of the context, there's a big focus on people with learning disabilities, particularly who display behaviour that challenges, and it's a busy time in terms of policy and guidance coming out, and this is another guidance coming out. But I think it's a group that we do know have historically been overlooked. Things aren't right. There's a perceived slow and locally patchy implementation of the Transforming Care programme. There's lots of published guidance, but there's a real need to link that with research and the evidence base, and try and make to look at how robust some of those recommendations are from an evidence-based perspective, and also just really understanding the real-world context and the financial pressures. So that was our context. In terms of how we looked at the evidence base, we looked at the best available evidence, and there was a review of thousands of studies looking at the content and quality of those studies, and they're all rated in terms of their quality. There was a big thorough review that happened at the beginning of the committee, and one just before the end of the committee to make sure that we were tracking the most recent evidence base as well. And where there were critical gaps in quality published evidence, and there were some gaps, we used expert witnesses, and we looked at committee consensus and modelling, and just someone as within the guidance committee having the guidance committee and the representation we had was absolutely central.
Thank you. A couple of people are checking whether the slide pack will be available to them. We will make sure they are available to people so that you can look at those at your leisure also. And we'll try and make sure that there's sufficient time spent so that people can absorb what's on those slides.
So in terms of the complementary guidance, this guidance sits hand in hand with the NICE's clinical guidance, challenging behaviour and learning disabilities, prevention and interventions for people with learning disabilities whose behaviour challenges. So that guidance very much looked at the kind of clinical provision around people and thinking about what journey from a kind of more health perspective would be needed. And our guidance complements that, but it's looking at the service side of things. So what are the service structures and what needs to happen alongside that to ensure good support. There's of course all the guidance that's come out around transforming care, so building the right support, the national service model and the service specifications, and the papers around children and young people with learning disabilities, autism or both. And they're all really key, and I would say that there's kind of a body of guidance that is essentially saying quite similar things but for holding on to different perspectives, and they're all really important. And they're just to name but a few. There's a Lennon-Hone review as well. There's a lot more, but we're just mentioning the most recent ones.
Thanks, Karen. So we're now going to move on to talking about some of the key content of the guidelines. The first key area that we looked at was around commissioning, and we recognise that there's a considerable commissioning challenge, and for that challenge to be met, there needed to be the right structure, role and experience. So we've recommended that there's a single lead commissioner who has oversight for all people with learning disabilities, all services for people with learning disabilities, and that individual must have in-depth knowledge and experience of children and adults with learning disabilities and behaviour that challenges. So the role is about all people with learning disabilities. The experience and understanding they bring must include specific experience of children and adults with learning disabilities and behaviour that challenges. They must have strategic oversight of all services that are specific to people with learning disabilities. The exact form and structure obviously will depend from local area to local area, and they should take a whole life approach, so not considering, so working to make sure that some of the cliff edges that people currently experience at times of transition no longer are cliff edges. So we saw getting the commissioning structure, function and competencies right as absolutely essential to the implementation of both this guidance and other complementary guidance. One of our broad messages was to get the commissioning right, and then to proceed with many of the other changes which our guidance throws a new fresher light on, but that have been known in many cases for several years and decades.
Yeah, I mean this was a huge theme throughout the guidance duration, the committee duration, and a real factor in a lot of the barriers. So we've really emphasised that. I'm just going to read this quote by Justin Hackney from Lincolnshire County Council. Working alongside our well-established integrated assessment and care management team and pooling budgets for adult social care and NHS continuing healthcare have been vital to the success of our TCP.
And so that Justin's quote obviously brings up another really key element, which is about joining up commissioning across health and social care, pooling budgets and resources between them and with education, so that people are no longer kept in that argument over is it coming out of this pot or that pot. We felt that was both a difficult and essential change that people make, and recognise that many NHS bodies and local authorities are already doing that. Many more are looking to do so, and many more we hope will in the future. We also recommended that the most specialist support services, there's consideration given to jointly commissioning those across different local areas, given that the populations in need of those very, very highly specialist services may not be large in number, but will be great in need.
So I'm just trying to get to the next slide. I mean, we felt that personal budgets and the funding mechanisms for budgets was really key, and we recommended that we need to support people to use personal budgets and ensure a range of funding options available, for example, direct payments and individual service funds. And we also heard quite a lot about flexibility around funding mechanisms to support community-based responses. So, for example, one of our expert witnesses talked about contingency funds and having an extra pot of funding that could be used very flexibly and very quickly to avert or address crisis issues. Planning, quality and outcome was a real theme and linked to the overall commissioning picture. So the idea of really having kind of plans ahead and delivering services based on the best available local evidence and needs. So really having very good data on your local population and needs and factoring that in terms of planning ahead in the service delivery. To have a collaborative and involving approach to planning. So we heard some really good practice examples where commissioners, families, providers and clinicians were all around the table together in planning, and that seemed to translate to better outcomes. And the same for risk sharing, where risk was shared. And there was a real approach to working together and monitoring of how that translated to outcomes. That felt really important. And throughout the conversation, there was something about quality assurance and how to make sure that we're delivering quality services, that there's a focus on quality of services and how it translates to outcomes, both service level outcomes and individual outcomes.
Just before we move on from that section, which has been about commissioning, funding, planning, quality and outcomes, what we'd like to ask you in a poll is whether I'm just going to get the wording of this right, so hold on 2 seconds. We're going to ask you whether these things are already in place in the area that you're working in, and secondly, we're going to ask you whether the guidelines can help planning the changes that are needed. Steve, I think you have some wording for us coming up now. So is this already working well in your area? We're really keen to hear your experience. Okay, so we can see that that's gathering together. Roughly a little bit more than twice as many people are saying that no, at the moment things aren't working the way that they should do, as a saying that they are working well, and that's continuing to sort of track forward. Thank you, Steve. And if we can ask our second linked question to that, please. You can still continue to answer both. We're just having a slight technical issue sliding the questions across, and there we go. So our second question was, could the guidelines help in planning changes? That's an encouraging early sign. Yes. Phew. You don't know how it feels to have sort of three and a half years work sort of positively responded to. That was a moment of tension. Thank you. So overwhelmingly, we're getting some things that, if they're put in place, would help.
So I guess what we're hearing loud and clear is that the commissioning and the strategic side of things, for the majority of people, isn't working very well. Although it's encouraging that 23% of people, they feel it is. That's really good. But that the guidance could make a difference. I think there was it's hard to track the chats as we go along, but there's something about, does it include the right workforce? And yes, we are hoping that there's something about the strategic input, including workforce.
And I believe that we've also made some recommendations about the need for and benefits of some further research in relation to workforce. If we move on to another of the critical areas that we considered, which is about support for families. So we talked about the need for families and carers to receive the support they require to care for the person that they care for their loved one, but also to care for themselves. And we talked about some practical ways of ensuring that was in place. The importance of short breaks was emphasised, and we did some economic modelling that showed that providing short breaks in the right circumstances was not just the right thing to do, but also provided the cost-effective thing to do. We talked about the importance of, and we make recommendations about enabling access to specialist support, and we talk about the importance of information, advice and guidance, because it's vital that the right support is available and can be made available. Without people knowing about that and getting the right guidance, it's not of as much value. So both of those things are absolutely critical. We talked also about the importance of enabling person-centred care and support, that it was central to involve people with the learning disability and behaviour that challenges throughout, not just in the easy and positive decisions, but also the tough, hard decisions in people's lives, that we mustn't lose our values of properly involving people when the going gets difficult. There are recommendations about the need to offer advocacy, a very strong focus on coordinating care and support, and particularly a strong recommendation that there's a named worker for each person with learning disabilities and behaviour that challenges, and that there are regular reviews. You can see we kind of ran out of space on the slide to talk about the number of recommendations that are focused on that need for coordinated care and support, and for a strong positive role by a named individual. It was important to us because we heard and understood both from the evidence and from the expertise that, about just how important that was in people's lives. I know when I meet people with learning disabilities in many services, some of the first things that I'm asked is what's happening and who knows what's happening, how can I find out? We come across as well professionals who are asking those same questions. a real need for greater understanding, coordination, and information to people. We talked also about some issues in the delivery of care and support, identifying health and sensory problems early, supporting communication, and again referring across to the previous NICE recommendation on prevention and intervention, and saying, well, actually, there are some things that people know work better than others in terms of how we support individuals. Those ought to be in place.
In terms of services in the community, our overarching view was thinking about prevention, early intervention and response, and we felt it was really important that community provision is commissioned to ensure that there's specialist prevention and early intervention. That's also a key theme within Transforming Care, the Lenihan Review, most other guidance, and it's really, really key. To develop capacity in the community to prevent avoidable inpatient admissions. Sometimes there was some services, but it was patchy and there wasn't sufficient services to meet need, or incredibly long wait lists, so that services couldn't respond as quickly as they would like. To think about quality assurance and service development, short-term assessment and intervention, longer-term complex intervention, and crisis response and intervention. We thought about the role of community learning disability teams, and I guess this is where it links with the clinical guidance, but in terms of what they should consist of, that included specialist support in relation to behaviour, communication, social care and support, physical health, mental health, education, and offending behaviour. We're talking about across the lifespan. We talked about enhancing community support, and we felt that there needs to be the full range of provision from the community, but also some kind of enhanced community support when families most needed it, specifically around people who display challenging behaviour, learning disabilities. So we talked about enhanced support for families, and that was a key theme that ran through our guidance committee actually. Early intervention and support to anticipate and respond to crises. There were times when people looked very surprised that there was a crisis, but actually a lot of those scenarios could have been anticipated with some earlier intervention. Ensuring the timely availability of expert support, and that consisted of specialist assessment and behaviour support, intensive behaviour support during a crisis, and a helpline, including out of hours. And there was a group that we felt we also need to comment on in the recommendation specifically, which is services for people in contact with or at risk of contact with the criminal justice system. And again, there's overlap with the clinical guidance here. There's lots of shared themes that came through that link to the commissioning, thing like joined up response, good planning, being responsive and timely.
Karen, I know you're going to move on and give us an example. Perhaps I can just pick up on one of the comments in the chat at this stage and clarify who the guidelines applies to. So there was a really important and really good question about whether it applies to people with learning disabilities, autism, or both. The guidelines apply to all people with learning disabilities and behaviour that challenges, including people who also have autism. Where it differs from the Transforming Care guidelines is that it doesn't specifically consider people with autism who do not have a learning disability, and that was to do with the scope of the guidelines that we were given in the commission of those from the Department of Health. It may well be that much of what we say does also apply to people without learning disabilities, but that isn't something specifically that we were able to look at, so we can't say that with any certainty.
Yeah, that's an important point. Just going to give a few examples, and as Jonathan said, they don't necessarily link with what was covered in the guidance committee, but they just give a flavour of some of the ways enhanced community provision can be helpful. So I'm just going to briefly talk about Southwark Enhanced Intervention Service, and that was a specialist team that sat as a kind of extra tier to the current community learning disability team provision within Southwark, and we're talking about adult services at this point. There was a remit to work preventatively with local services to increase their capacity to create capable environments through training and consultation. There was the idea that they could offer rapid, flexible and intensive multidisciplinary support at point of crisis or at risk of crisis, and try and avert potential service or family breakdown to avoid hospital admission, placement breakdown or out of area placement. One of the key things was just timing. Timing was everything. As soon as families were in difficulty, they massively fed back that as soon as you have a quick response, it's very, very helpful. There's also something about service design, planning and strengthening services. So that bespoke planning that came hand in hand with providers, local authority, families and the person with learning disabilities as much as possible to think about what bespoke service design could be around for that person. And in terms of the sort of approaches that we used, positive behaviour support was a cornerstone approach, but we used systemic approaches adopted from family therapy ideas to think about network meetings. There was also a care coordinator, so that coordination that we talked about earlier was absolutely key. Families were a key part of the planning and oversight of the work, and it was shared in those network meetings. So meetings could be as often as weekly, they were very frequent. And I guess I'm giving examples with that are quite different services, but for example, Ealing Intensive Therapeutic Short Break Service, that's aimed at younger people with learning disabilities. And it's a service that offers hand-in-hand short breaks with some intensive therapeutic support. And I guess the point is that we saw lots of services around the country that have all approached this in different ways. They're configured differently. There's a PBS service in Halton as well. That they've all approached it differently, but they've got similar themes, most of them. Okay.
That's great. We're about halfway through this webinar, and we're going to do the next of our polls, and then I'm just going to pick up on a few of the questions on the chat forum. So the next of our polls is asking the same questions about how things are working at the moment, whether the guidelines can help. This time focusing on the sections that are around support for families, care coordination and support, and enhancing community provision. So the last few sections and themes that we've worked through. So Steve, can we have those our favourite two questions back up on the screen, please? We're just doing a little bit of technicalities on that. While we do that, let me pick up on a couple of questions that people have asked and comments that people have made. Long waits for specialist behavioural support. I think that's something that's been experienced by very, very many people, and particularly that's why we're making recommendations that there is that level of availability in each area, and we're suggesting the importance of very timely access to behavioural support, both to avert crisis, to plan ahead, to support families, to support individuals, and in response to crisis. Question about whether ADAS was consulted in drafting the guidance. Yes, and ADAS responded quite fully in the formal consultation. So we consulted formally on the guidance and publicly, and received a very high number of responses, both from individuals and organisations, and ADAS certainly was strong on that. And just finally to say, really pleased to see the focus that people have taken on supporting people when they go into acute hospital, obviously a really critical area in people's lives. Yeah. So we've got our polls that are coming through, which are showing at the moment that we've got significant numbers of people where things are working well, that hopefully can provide some sort of model for other areas. More areas at the moment where things aren't working so well, and again a sort of a strong view coming through that the guidelines could help us in planning changes.
Yeah. Okay.
Should we move on to talk a little bit about housing now?
Yeah.
Yeah, let's do that.
Oh.
Okay, so we looked at the housing options that that ought to be available to adults firstly. So this slide and section applies specifically to adults. We recommended that commissioners work with both housing and care providers to ensure that there's a range of housing and care options available. There isn't a one-size-fits-all solution. We do recommend that people are offered the choice to live alone with support where that's what they want and where it's appropriate for them to do so. So one of the key messages that we received and we wanted to echo was to challenge the model where people who can make themselves or others very vulnerable as a result of their behaviour should live with quite a number of other people who may make themselves or others very vulnerable as a result of their behaviour, and to suggest that in some cases actually it's really important that people are offered the choice to live alone with appropriate support and care. Where that isn't what the person wants or that's not appropriate, that people should be offered the opportunity to share with a small number of other people. We found no evidence that a large number of people with similar needs living together was a positive thing to happen and delivered positive outcomes. We are recommending the options that provide for a greater security of tenure, including ownership and real tenancy rights, are preferred over options that do not provide that kind of security. And obviously important, but not always the case in practice, that people do get offered the choice and opportunity to live close to family and to friends.
Okay, just going to give another example, this time from West Sussex, and it's just another flavour of enhanced support services, but also thinking about how that can link with where people might choose to live, or thinking about supporting people with very complex needs. So the West Sussex Enhanced Support Service sits within community learning disability teams, but it has a ring-fenced function, and it offers intensive rapid support for people presenting with the most at-risk challenging behaviour. It's in West Sussex's integrated health and social care teams, and I think that's been really helpful because it's enabled quite good planning and a real joined up approach. So there have been examples where we've been able to develop bespoke capable environments, working really closely with local commissioning, local authority, families, service users, and the clinical team, to inform what a capable environment might look like for somebody and how that can translate to housing in terms of bricks and mortar, but also in terms of the provision of support. And again, that kind of intensity and timeliness of support was really, really key. So that's key messages coming through. Okay. So in terms of specifically for children and young people, I mean, this is a theme that was really important in the guidance committee, and we kept coming back to it. But they're really, support for parents and carers to care for their children is absolutely essential, and we need to ensure that the full range of options for education, care, and support, including specialist support, is available. And support for parents and carers to understand this, so how to navigate through the system. We've made a specific recommendation, including specialist behavioural support from education and CAMS practitioners with specific skills. And again, that's been picked up in previous recommendations and guidance, but that came through in our kind of rigorous looking at the research evidence and expert witnesses in the guidance committee. And it's really important that there's provision and support around and interventions in line with NICE's guidelines on challenging behaviour and learning disabilities, the clinical guidance, and that is delivered.
We also looked specifically at the issue of residential placements for children and young people, and we felt that it was really important that there's a very thorough consideration before offering residential placements to children and young people, but it had to take place against the backdrop of actually developing a good range of support for children and young people. So prior to placing children or young people in residential placements, all options ought to be considered with the child or young person and fully involving the family and carers. There ought to be independent and expert involvement in that review, and that children and young people should only be placed in residential placements if their needs cannot be met at home and there's been proper exploration, consideration of the alternatives, and those have been ruled out, or that it follows through a proper consideration of a request from the family under the relevant legislation, which is the Children and Families Act, that placements should be as close to home as possible, and that families and carers should be supported to maximise contact. And we recognise the real barriers that can exist to that, including financial barriers, and that steps should be taken to help families to overcome those, and that plans should be made wherever appropriate for the child or young person to return home, and that those plans should be regularly reviewed. We spoke earlier about the importance of keeping things coordinated and well reviewed. We also looked at when inpatient services should be used for adults, and we've said very clearly they should only be used if the person's care needs cannot be met safely in the community, and all possibilities for community support have been considered and exhausted, including with independent and expert input. So a really hard look at can we do something different that would avoid the need for somebody to be admitted to inpatient provision. Where it is required and necessary, they should obviously be as close to home as possible, and plans for the persons to move out should be developed from the time of admission. So very much echoing some of the recommendations in building the right support there. And those plans should be regularly and frequently reviewed, including with the person, with their family, with the decision maker present, an obvious point but not one that's always in practice, and with proper behavioural expertise, so there's a real knowledge and understanding of how the person could be supported as well as possible.
And I guess just to add that we're aware that links very closely to some of the recommendation and guidance from Transforming Care, but in a way we reached the same very similar conclusions, and that's reassuring in a way.
Yes, I think if we decided that we had the evidence pointed in a very, very different direction and drew very different conclusions, that would be more concerning than actually what happened, which was that we strongly supported and felt that the evidence base supported some of the key elements of building the right support. So there's a high level of consistency between them. So what we've done so far is to run through some of the sort of key elements of the guidance and recommendations. Hopefully along the way we've been able to pick up some of the observations that people have had on the chat. We're going to ask a final poll, sort of taking the last sections of the guidance, and again asking you the same questions on those. So this is taking the sections that are on support for children and family, residential placements for children and young people, and inpatient services for adults. And we'd like, Steve, with your help, to ask the same questions in the poll of participants. So we're going to be asking you again, how are things going at the moment, and can the guidance help in planning changes in these areas?
And I guess we're aware that a yes/no poll isn't ideal because there's nuances in between, but just for ease, stuck to yes or no.
And while we're pulling that up, it's really nice to see the conversations that are going on about providing support for people to remain living with their families, and the use of DFG and other mechanisms to ensure that the adaptations can be made. So we're just pulling up those, getting some answers through. That's great.
I think the percentages for yes are a bit higher on this one, which is encouraging.
Just giving that a second to tick through. Fabulous. That's really helpful. So again, there's a significant number of areas in which things are working well. Roughly sort of 1 in 3 or so. Roughly 2 in 3 where things aren't working so well at the moment, and a clear consensus that actually implementing the kind of changes in the guidelines could make a substantial or could make a positive difference. So that there's obviously a body of areas where things are working well, where we can learn from, and some recommendations that can help people. So what we've done in this presentation is we've talked through, so we're just having a little bit of a juggle with the polls. And so we've talked through a number of the key recommendations in the guidelines and a number of the key sections in that. We've heard from people that the practice at the moment is very mixed. There are things that are working well in some areas, less well in others. Where we hope that the guidelines support and help change is that they provide that evidence-based framework to support people, families and communities. It isn't a pick it up, work through the checklist and everything will be fine. There's a very, very strong emphasis on getting the right leadership values in place, but there are some practical recommendations here which we believe, and the evidence has shown to us, can make a real difference. There is further work that's being done by NICE to help promote implementation. So we're developing some quality standards to measure where things are up to and to chart progress. There's a quick guide for commissioners that's in development, and we're working with other system partners, for example, NHS England and local government bodies, to help publicise the guidelines. So there's further work that's ongoing. I think there's a massive need here, and I think there's also a huge opportunity to improve things. I think that people with learning disabilities and their families deserve and require us to do so. I hope that by providing some of the underpinnings and the frameworks to enable and support real change, the guidelines can help in this. It will do if people like you pick them up, use them, draw attention to them, and keep the conversations going, and keep showing the great work that people are doing in areas. It's not about new and dramatic changes here to what we previously knew. It's about consolidating that and applying that, and I think that if we do that, we can make things a lot better for people.
Yeah, I agree. And just to add that, there were some gaps in the evidence base that we had, and we did use expert witnesses where we could in the guidance committee. But in terms of next steps, I see it as a real invitation to think about how we evaluate services out there, service models. So there's a lot more that we could build on from this as well. So this is just a starting point, I guess.
So finally, to thank people for attending today. The slide pack will be available to people. We'll also have a proper look through the comments, and if there are particular issues that have come through in that we haven't been able to pick up along the way, we'll see if there's a way that we can come back to you on that. But for now, thank you ever so much for your participation and involvement and your ongoing work. We'll draw things to a close, and goodbye from us.
Yeah.